I had a hunch that something was really wrong.
I nearly lost my life in 2019.
The medicine from it was starting to tear me up from the inside out.
And so while the doctors were running these tests, I was researching late at night.
I lost my job, I lost my stamina, and a little bit of my sanity.
Physical, mental, it was just a lot of strain.
I'm Ashley. I'm the mother of Harrison, who was 9 years old when he developed DRESS 1 year ago. And he took Bactrim for a bacteria infection that he received when he scraped his knee falling off a bike.
My name is Kirt Thibodeaux, Jr. I was diagnosed with DRESS syndrome in 2017. I was prescribed minocycline by a dermatologist for what I thought was going to aid me in my fight with ingrown hairs.
My name is Joanne Foy, and I experienced DRESS in June of 2020. I had surgery and developed MRSA, staph infection, and was on an IV line of vancomycin.
My name's Jenna Pehrson, and I was diagnosed with DRESS syndrome in July of 2019. It was lamotrigine, and I was taking it for, they were trying to treat migraines.
2 weeks after he started taking Bactrim, he developed fevers and a lot of neck pain, which was odd. And so we rushed him to the ER. They sent us home after some thorough evaluations, and it seemed to be nothing. 2-3 weeks out, he started having his lymph nodes started to swell, and on the back of his neck, he had probably a good golf ball sized lymph node.
They started off as like just kind of chilling, like my entire body was always cold. I live in Louisiana, so it's hot. It's, humid. And I'm finding myself, I'm wearing jackets outside as well as inside. And then it's like I noticed that my skin on my face, like it'll look like I'm having like an outbreak or something, but it's not even like an outbreak. It's like almost eczema is what I want to say.
3.5 weeks into the vancomycin, I developed a severe generalized rash all over and was misdiagnosed repeatedly and in and out of ERs 5 times, and finally found an immunologist who diagnosed me with DRESS syndrome. And I started out with a very fine rash. It was on my abdomen and on my inner thighs. It was very itchy and very... it was red and just a unique looking rash. As time progressed, it became this beet red, maculopapular, all over my body, extremely itchy rash, like miserably itchy rash.
My first symptoms that I had experienced was a fever of 104.7. I was completely red in the face, and I thought it was because of the fever. But in reality, it was the rash that was starting to present itself.
Certain parts of where I have these white patches, that's really where the rash was. So as big as these white patches are on my body, that's how big that rash was. It was like plaques.
I did have the facial edema and swelling as well, and it actually went down into my legs as well, and then on my back, and then it progressed up onto my chest.
He had reached a point of fever of unknown origin after 21 days of straight fever. And his fevers were high, 103, and he was miserable. He was so sick. And so infectious disease was actually looking for everything else that could cause infection from their realm, but forgetting to even question the drug.
Because I was so delayed, I believe in getting diagnosed and shutting down my immune system. By the time I was hospitalized on July 3rd, I was extremely edematous, swollen all over, extremely short of breath. I couldn't climb a flight of stairs without either becoming really short of breath or fainting.
And so we went to the ER, and they were in contact with dermatology since I had that punch biopsy the day before. They finally sent over the blood work, I've had blood work 3 or 4 times, but they sent the blood work up to there, and the dermatology department up there said, start treating her with prednisone or Solumedrol. I think it was Solumedrol, and load her up in the ambulance and get her up here.
To be inside of this body in the war zone that was going on at the time was just, I promise you, unimaginable. I wasn't diagnosed with DRESS until July. July, when I went and saw the dermatologist that would later figure all of this out.
It wasn't until I believe week 3 that he developed a rash that was quite concerning. And we were going to see doctors multiple times a week, had doctors on call a lot, but they weren't as concerned as we were.
They were reading that blood work with the eosinophils, the liver enzymes were elevated. They could see I was an active liver failure.
I definitely think that being of a darker skin complexion or darker skinned man had something to play into it, because I remember when I went to the emergency room, I was tested for HIV and AIDS, no lie, 7 times.
So Harrison was on Bactrim for about 2 weeks before his first symptoms took place, and it took about another 2 weeks before they decided to stop Bactrim and give him a different antibiotic. I don't think they realized what was still happening at that time when they did that. They just knew that the blood work was really off, and so they decided to switch antibiotics.
I think finally when I got the facial edema and the swollen, lips and face, it was the telltale sign. They started to put it all together like, oh, maybe this is stress. And my HHV6 too. They also did a viral titer for HHV6, which was like 999,000. It was beyond high.
The doctor that finally gave me my diagnosis for DRESS syndrome is Dr. Scott Jackson. It's like he immediately looked at me and he knew. It was like, I remember he raised my arm up, he looked at my hand, and I was like, how is this man not disgusted with touching the skin right now? He had so much to do with just getting me back together and just kind of, saving my life almost.
I was lucky enough to have a team of doctors who recognized it. I seriously lucked out with my team being diagnosed within 12 days, getting on the proper dosage of steroids.
And it was the DRESS Foundation who actually said, this is most likely DRESS, and coached us to help our doctors understand this and really take action towards DRESS. The medical community where we were at that time was not looking for DRESS. They were looking for something else. And we had to convince them to look at DRESS. And the way that we did that was after we had reached out to the DRESS Foundation, and they had reviewed the case, they then coached us and became our advocates so that we could advocate for our son. So that we could advocate for our son, so that the doctor would actually look to see if this was DRESS.
So between the rashes, the vision loss, my heart valves were damaged, and I get short of breath and lack of fatigue. I also get like fibromyalgia. I get a lot of autoimmune symptoms, just body aches, and it takes me way longer to get better than I think I did prior to DRESS.
So the conditions that were brought on by DRESS syndrome that I have are alopecia universalis and vitiligo, both which are autoimmune diseases. So, of course, my body still fights itself again.
Going through it, I realized how alone you can feel. The fear of the medications, any new medication that you can possibly take.
But I had a lot of anxiety, a lot of stress, PTSD in a sense. I ended up having to stop working as an ICU nurse because my immunologist felt it was too stressful.
When our family or Harrison starts a new medication, we're all on pins and needles. We're always watching for any particular symptoms, especially like headaches, just because that was the first one that we saw.
I would love for the medical community to realize that with DRESS, there isn't one exact symptom and side effect. I believe there's a lot of long-term side effects that everybody is affected differently. I think it's easy to throw it aside and say it's not related, but I do believe when the immune system has been triggered, everybody's individual immunological response to situations and insults reacts differently.
Don't miss the underlying factors, because sometimes those underlying factors is, what really gets, in some cases, cause the fatal diagnosis. Give it as much attention as you would give cancer, or as much attention as you would give an AIDS patient, or somebody with leukemia.
As you're diagnosing a patient and trying to figure out what's wrong with this person, you're always looking at statistics. You're looking to guide you, but as a parent, our child isn't a statistic.
I think it's essential that people know that we need to have that blood monitoring throughout, and it's not just you need to go in weekly or bi-weekly depending on how severe the case is, and following through, and then listening to your patient's comments and concerns. Going through it now, like I'm going to neurology every 3 or so months. And it doesn't seem like those doctors take it seriously. They kind of brush it off.
They need to listen to their patients. They need to listen. Like I begged for 4 days for a CAT scan in my lungs saying something's wrong.
One thing that I would love for other DRESS patients and their loved ones to know is you are not your diagnosis. And the reason I say that is because DRESS is something that I went through. It's not who I am.
Fellow patients and loved ones to know that we need that support to lean on, because it is a scary, scary place.
One, it can happen to anybody, and it can happen with a simple antibiotic that you wouldn't think you would have a reaction to. And secondly is, you cannot advocate enough for yourself, for someone else, or for your child when this is happening. Just know that if you have a hunch something is wrong, it probably is, and you just need to continue to advocate and get support around you to help you navigate that.
I could finally, I'm living through those moments. I could finally, start or look forward to, I guess building myself back up day to day. Like I'm living like I don't know what's going to happen next, because I didn't. I got up with faith and I carried myself through the day with faith, but sometimes it lingered.